Hello, Shemai, I'm Meryl and I'm lead antimicrobial pharmacist for primary and community care with Public Health Wales, and I'm going to be speaking to you today on backup antibiotic prescribing. So why do we need to be using a backup antibiotic prescribing strategy? Antimicrobial resistance has been headline news for a while now, with the previous chief medical officer stating that antibiotic resistance is as big a risk as terrorism. And we are aware that global deaths from antibiotic-resistant infections are on the rise. And that is why the WHO has designated antimicrobial resistance as one of the top 10 global health threats. The British Medical Journal stated back in 2008 that without effective treatment and prevention of bacterial infections, we also risk rolling back important achievements of modern medicine, such as major surgery, organ transplantation, and cancer chemotherapy. We can tackle the problem by implementing good antimicrobial stewardship, and one of my favourite definitions of antimicrobial stewardship comes from the British Journal of General Practice. Prudent prescribing is not to prescribe as few antibiotics as possible, but to identify that small group of patients who really need antibiotic treatment, and then explain, reassure, and educate the large group of patients who don't. One strategy to reduce unnecessary antimicrobial use in primary care is the use of backup prescribing for specific self-limiting infections. NICE and AWSG guidance recommend utilising a backup prescribing strategy with advice if there is uncertainty about whether a condition is self-limiting or is likely to deteriorate. And back in October last year, the Wales Backup Antibiotic Prescribing Good Practice Guide was launched. The guide was prepared by a multi-professional collaborative group following discussions within the primary care workstream of the then Antimicrobial Resistance Delivery Board, and the guide is relevant to everyone involved in the prescribing, dispensing, issuing and administration of antibiotics for self-limiting conditions. The evidence suggests that when compared to immediate antibiotics, a backup prescribing strategy has no adverse effects on symptom severity, duration, hospitalisation rates or patient satisfaction. And also, when we compare immediate antibiotics to backup prescribing, the evidence suggests that this leads to reduced consultation rates and reduced antibiotic use. However, backup prescribing is not suitable for all, and there are certain special considerations. We should not consider a backup prescribing strategy if a patient is systemically very unwell, has signs and symptoms of a more serious illness or condition, or is at high risk of complications. Another group where special consideration is required when utilising a backup prescribing strategy is infants and children. The Royal College of Paediatrics and Child Health has made a statement on the use of backup antibiotic prescriptions in infants and children, which has been endorsed by the Royal College of General Practitioners. It recommends the following special considerations when using backup antibiotic prescriptions in infants and children. It is never appropriate to use backup prescribing in children under the age of 3 months. Children under the age of 2 are a particularly vulnerable group, and the use of a backup prescription for these patients would not be considered as part of routine practice. In all children, it is wise to have systems to enable and facilitate further and prompt review. There should be a low threshold for review whether an antibiotic is prescribed or not. Safety netting advice should be given in the form of guidance on when to have concern and seek further assessment, and this must be tailored to the age of the child, the understanding of the parents and the home circumstances. Existing resources such as the When Should I Worry booklet, which is available in both English and Welsh, contains excellent information for parents about a wide range of conditions to improve safety netting. So for which indications is a backup prescribing strategy appropriate? The Royal College of General Practitioners supports the use of backup antibiotic prescribing for acute otitis media, acute sore throat, acute rhinosinusitis, and acute cough and bronchitis. NICE also advocates backup antibiotic prescribing for the management of a certain cohort of patients with simple UTI. These patients are encouraged to self-manage their infection with antibiotics only used if symptoms persist or worsen at any time. Within the guidance, there is an antibiotic backup prescribing overview table. The table contains information on the indications where a backup prescribing strategy is appropriate, and specifies whether a no antibiotic, a backup antibiotic, or an immediate antibiotic prescription should be issued. It also contains information on the typical duration of the illness and also specifies how long a patient should wait before taking the antibiotic prescription. There are various methods to implement a backup prescribing strategy, and which method is used is dependent on the patient, the prescriber, the setting, and other considerations, for example, around a weekend or a bank holiday. The three methods recommended by the guidance are patient-led, where a prescription is given to the patient during the consultation, but they are counselled not to get the antibiotic dispensed unless the symptoms worsen or do not improve within a specified time frame. Collect at a later date. With a collect at a later date strategy, the prescription is made available to the patient for collection from an agreed location if the symptoms worsen or don't improve within a specified time frame, for example, at a GP reception desk or a community pharmacy. And finally, recontact. And with the recontact strategy, the patient is recommended to recontact with the service for further advice if their symptoms worsen or don't improve within a given time frame. Patient counselling is an essential aspect of backup antibiotic prescribing and is imperative for successful implementation of the strategy. As a minimum, the patient should be counselled on the reason for giving a backup antibiotic prescription, how to self-manage their symptoms and how long their symptoms are likely to last, when to access their antibiotic treatment and how to access this treatment. They should also be given safety netting advice, highlighting symptoms that they should be looking out for, especially any red flag symptoms that should prompt urgent assessment. You can use the Target Antibiotic Toolkit and backup prescription patient information leaflets to help with these counselling points during the consultation and also to help with patient recall of information after the consultation. There are certain good practice points to consider when utilising a backup prescribing strategy. The prescriber should document clearly the issuing and the reason for issuing a backup antibiotic prescription with an appropriate clinical code in the clinical notes. They should write backup prescription in the dosage instructions to ensure that the dispenser is aware that this is a backup prescription and can appropriately counsel the patient. Write do not dispense or please destroy after a certain date in the main bulk of the prescription so that the dispenser is aware of when the prescription should no longer be issued. And they should ensure that the patient and/or care provider has received and understood adequate information to utilise the backup strategy safely and provide patient counselling and safety netting advice. The dispenser should check any directions annotated by the prescriber, reinforce to the patient that this is a backup prescription and that the antibiotics should only be taken when and as instructed by the prescriber. They should provide personalised advice for the specific antibiotic issued and provide patient counselling and safety netting advice. They should also safely dispose of any prescriptions as directed by the prescriber in accordance with local policy. There are various resources included within the guidance to support the implementation of a backup antibiotic strategy, one of which is a recommended course lengths for antibiotics poster, which includes information on specific course lengths for various indications. Also included is a backup antibiotic prescribing summary table, which includes information on when a backup antibiotic prescribing strategy should not be used, and specific information on the indications where a backup antibiotic prescription should be considered, and when a patient should be advised to seek further medical help. A poster on how reception staff can support with antimicrobial stewardship initiatives within a practice is also included, as well as a quick reference guide to backup antibiotic prescribing. Links to other useful patient resources are also included within the guidance, including various patient information leaflets, guidance on counselling, resources for community pharmacy, and posters for use within waiting areas. Backup prescribing patient information leaflets are also included within the guidance, which are available in various formats in both Welsh and English and are accessible via QR codes. If you want to learn more about antimicrobial resistance and stewardship, resources for healthcare professionals are available on the HEIW website via this QR code. Diolch am wrando. Thank you for listening.